we'll be talking about public charge and the impact that the coronavirus has had on those who may be facing immigration issues. And then at 2 o'clock, we're going to be taking your phone calls live. Um, I want to know what you think about the coronavirus, how it's impacting you, what your thoughts are, where you're at right now with the changes that are going to be taking place, and we'll go over some of those, like businesses being barred from serving customers who don't wear facial coverings. Just going to get the pulse of the community and see where your head is at on some of these things. But I think it's really important that we get our next guest on while we have him here with us. And I'd like to welcome King County Health Officer Jeff Duchin. How are you, sir?
I'm doing well. Thank you very much for having me today, Tony.
Well, you know, I know this is going to seem like just a really big question for the first question, and we got a lot of things to cover that can be more specific. But Jeff, what happened?
Yeah. Well, you know, we've had a global pandemic. Coronavirus happened. This is a virus that has never before affected the human population, and every one of us is susceptible. And what we're seeing now is the natural evolution of a new virus that moves through the aerosol route very easily, person to person through the air. It can spread when people contaminate their hands and surfaces. And we're not doing a good enough job at keeping ourselves away from one another to prevent it from moving, because it moves, it jumps from person to person very efficiently. And the natural history of something like this is, until enough of the population globally has been infected and developed some immunity, or until a vaccine becomes available that is safe and effective and provides some immunity, the threat will be with us. And that's a long-term threat. It's going to be not days, not weeks, not months, but many, many months and probably years. And the impact will lessen over time, but we are fundamentally going to have to change the way we go about our lives and interact with each other if we want to minimize the impacts of this virus on our health and on our community.
All right. Again, thanks for joining us here at Rainier Avenue Radio. There's a couple of things I want to go back, and they may seem redundant, but there has been some confusion. And we just want to make sure that as we approach the 4th of July weekend, folks are going to want to get out and want to gather, celebrate. It's understandable. There's a lot of things going on in the world right now. And as human beings, we are social people. And the isolation does do things to people. We know that for sure. We know that there are those who were far worse off isolating because of a number of different circumstances. So here we go. We approach 4th of July weekend, and I would like to find out what we need to do so that we as a society are safer over this weekend. If it's really necessary to do anything differently, what might the consequences be? And so I'm going to start with this. Early on, we were told not to wear masks. Wouldn't really make a difference. Now, everyone is being told to wear a mask. As a matter of fact, you can't get into public places anymore without a mask. So can you tell us about the mask, what the mask does, why we were told one thing, and then why we're being told another thing?
Yes, it's a really important question. So new virus, when it emerged, we didn't know much about it. And recommendations were made based on similar related viruses like the SARS coronavirus and the MERS coronavirus and the seasonal coronaviruses that circulate. And those viruses primarily transmit after someone becomes symptomatic or develops symptoms, they spread it, but not before to any great extent. And those viruses primarily spread through droplets that are expelled when someone coughs, talks, sneezes, and so on. But because at the initial outbreak of this virus, it was not recognized that this virus can spread very readily before symptoms develop. Right, that took a while to figure out. We now know it can spread from people who don't have symptoms in the period before it develops, and some people never develop symptoms. And we now know that given the amount of virus that's coming out of people before symptoms develop, we need to do something to minimize that risk. Initially, masks were recommended only for people after symptoms developed. And that's because we know that they're effective in blocking those infectious particles. But what wasn't recognized is that that can happen before symptoms develop. So the guidance all along has been, if you're symptomatic, stay home, don't be around other people. The key difference is that we're finding that this virus is so contagious that we need to take every possible precaution to prevent it from spreading. And that means if we don't prevent the spread from people who don't have symptoms, we're not going to be successful in preventing the spread at all. We can't just focus on people after symptoms develop and ask them to isolate and put masks on. So two things then led to the recommendation to wear masks, and these are critically important. One is the fact that people can spread this virus very effectively before they know they're sick, before they feel sick, before they have symptoms, and that this virus spreads and can be blocked through cloth masks. The issue with respect to mask recommendations has to account for the fact that our healthcare providers who are putting their lives on the line every day also have shortages of medical grade masks. And so we didn't initially feel like it was a good idea to try and compete with the healthcare providers for those medical grade masks when there was not any reason to believe that mask use among asymptomatic people was useful. Now we know it's a very different situation. We know that we can get great benefit from cloth masks, homemade masks, when they're made properly in particular. And also we know that we need to wear masks when we're healthy, when we don't recognize the symptoms. And it's also very important to understand that masks are not 100% protective. They mostly protect others in your environment, in your community, from someone who is infected and doesn't know it. So we all wear a mask to protect one another. When I wear a mask, it's preventing my infection from infecting you. When you wear a mask, it's preventing your infection from infecting me and others in your environment. But they're not 100%. And the single most effective way to stop the spread is to stay away from one another. And as you said, we're social. We can't be isolated forever. We have to have some interactions. So it's masks plus distancing, minimizing close contact with others to the greatest extent possible, staying in areas where there's good ventilation to dilute that virus. Small enclosed spaces are more risky than outdoors, and indoors which have good ventilation and open windows, and then limiting the contact. The less time we spend in close contact with one another, the lower the risk will be, and the more time we spend together, the greater the risk will be. And those are the only things we can do to interrupt the spread of this virus. And if we don't do them, we're seeing the result right now. We're seeing our cases going way, way too high. And I'm concerned that we're going to see an impact on our healthcare system, and we're going to, unless we do something differently, we're going to have a large amount of serious illness and threat to our healthcare system in the coming weeks.
This is Rainier Avenue Radio. It's me, Tony B. You're listening to our weekly coronavirus special. My guest is Jeff Duchin, King County Health Officer. What I heard you say was these are the only things that we can do. to prevent the spread of this. So we make sure that our audience understands some things when we're doing here, that as journalists or the shows that we run in, and basically break this down into three areas. One is opinion. Then there is this thing called fact-based opinion, and then there are facts. The information that I just got from you, again, remember, because at one point we were told to do one thing, and we thought that this was based off of some sort of health officials were telling us. So the information that you just gave to us right now, would you classify that as opinion, fact-based opinion, or facts?
That is those are recommendations based on facts. And over time, with a new emerging infection, when that appears initially and there's no experience, the facts available are very limited to base recommendations. And so recommendations are always based on the best available information at the time. We have more information now than we had when we recommended mask use only for people with symptoms. Now we know, we have facts to tell us that infection spreads from people before they have symptoms. Fact. Infection spreads through the air and through droplets. Fact. The only way to interrupt that spread is by staying farther apart and using face masks. Fact.
Okay. And what about this being the flu? We hear about more cases coming, and that's a whole nother thing we'll talk about more, and folks being asymptomatic. This is just another version of the flu. As a matter of fact, more people, this is things that we're hearing, die from the flu. Now, I'm not going to get into all the conspiracy theories and the politics behind coronavirus that are driving some of these messages. Is this just another version of the flu? If so, why? If not, why not?
Well, I can see why people say that. It's a respiratory virus, and many of the symptoms are very similar to influenza. It causes pneumonia, and it can cause serious illness and death, which influenza can do. The difference between this virus and the flu, though, is it is a different species of virus, different family of virus. So biologically, it's not influenza. It's a virus that has never before impacted the human population. So unlike influenza, none of us have any immunity to it. With influenza, over our lifetimes, we're infected many, many times, and we have some protection against influenza. So that's different. We're much more vulnerable to this virus. And with influenza, we have both a vaccine that is very effective in preventing severe illness and hospitalization, and we have antiviral treatments. For COVID-19, we have neither a vaccine nor widespread availability of effective antiviral treatments. So this virus has the potential to cause many, many more serious illnesses and deaths than influenza. The case fatality rate, or the proportion of people that die from this virus, will change over time as we develop population immunity over years. But right now, it's much higher than influenza.
Again, you're listening to our coronavirus special. These droplets, through talking, through sneezing, through coughing, through singing, through whatever it is that you're doing, how long do they stay in the air? We're talking about the 6 feet separation. Do they just float in the air for minutes, hours? Do they immediately settle down on the ground? What's the danger there? Maybe people are not wearing a mask and they're jogging and breathing hard. How long do we know they stay airborne?
Yeah, important question. So it depends on a number of factors. When someone is infected with COVID and they speak or cough or sneeze or sing or shout, little particles come out of the mouth. They're invisible. And there are a variety of sizes of particles. They're all microscopic, but even within the microscopic range, some are bigger and heavier, and they tend to fall to the ground within a matter of seconds to minutes. And some are very, very tiny, and they can remain suspended in the air for longer periods. How long they remain in the air in your environment depends on your environment. So if you're outdoors, for example, which is the safest place to be, with respect to COVID transmission. The natural ventilation of being outdoors, the wind and the high volume of air will dilute these particles very rapidly. And that's why we say if you're outside and you're able to stay 6 feet apart, mask use is not as important and it's optional. But when you're indoors, where there's less ventilation and there is no wind to blow away the little particles that come out of someone's mouth or nose, the large particles are still fall to the ground, within a matter of seconds to minutes. But the smaller ones can remain in that environment, in an indoor environment. And you probably heard about a very large outbreak that happened in a church choir up in Skagit, where there was singing and one person did not know, they had no symptoms, they did not know they were infected, but the virus then affected many, many members of that choir that were singing, and they were trying to take precautions to stay apart, but the virus clearly remains suspended in the air. So it can remain for minutes. And I don't know if I can tell you precisely, in any situation that you could predict how long a virus might be circulating in the air. It depends on how much virus was in the person who was doing the singing or the speaking, who's infected, and how much they are putting out into the environment, and the particular conditions related to ventilation and the size of the room. But the bottom line is it spreads through droplets that can directly hit you in the face if you're close enough, or get you in the eyes, or you can breathe them into your mouth. And they can also remain suspended in your environment for a long enough period for you to be infected if you stay there long enough, or if you're not wearing a mask. So the mask both blocks those viruses from coming out in the first place. That's its key role in blocking the virus and preventing it from getting into that environment and into that airspace. It may provide some benefit to the user, but that's less certain. But the distance, the 6 feet of distance, will dramatically decrease the number of virus particles that will reach you. And by limiting the time you're in contact with that environment where other people may be infected, will also very much decrease your exposure to that virus. So there are a number of things that you have to take into account here. Your closeness to other people, the environment that you're in, how well ventilated it is, and how long you spend there. All of those are really important in determining what your risk will be. And that's why we say stay as far apart as possible, have as few interactions as possible, and be in a well-ventilated space as possible, and keep those interactions as brief as possible. And that all those together will decrease the risk. And wear a mask.
My guest is, and thanks for coming on, by the way, on very short notice as we were approaching this big weekend. Appreciate you coming on and sharing this information so that folks can at least hear what our King County medical officer is saying. And we're going into this weekend where, again, folks will want to gather, and that's understandable. I don't know, Jeff, whether or not you know what the impact is or has been on gatherings like protests that were taking place quite frequently. I'm not just talking about the CHOP. I'm talking about multiple protests when folks were shoulder to shoulder. And if we've seen anything, and I'll get to that. But before that, this next question, let me know if this is a opinion, a fact-based opinion, or fact. Can this virus, can these droplets, can this be transmitted through the skin, through an open wound, shaking hands? Because what we're hearing is respiratory, airborne, eyes, mouth, nose. So if you're shaking hands, as long as you're not touching your face, or if you're running by and it's and it gets on your, and somebody sneezes, it's on your arm, whatever, your skin, any kind of way, it won't happen like that. And again, your answer, would you tell me if this is fact-based opinion, or fact? Can it be spread? Can it infect, whatever you want to call it, through the skin?
Yes. So again, important, good question. The virus can, here's a fact. The virus can spread from surfaces, and that can mean from a hand to another hand, and it gets on the hand from the mouth or nose. So the reservoir where the virus lives, this is a fact, is in our respiratory system. And if we touch our mouth or nose, or cough into our mouth or nose, or touch another surface that someone else has sneezed on or coughed on or breathed on, you can get the virus on your hand. That's a fact. And then if you touch something else, that virus will move onto that surface. So if you shake hands with someone, the virus will move to the other person's hand. If you hold a glass or a soft drink bottle or a utensil at a barbecue or a plate, fork, or knife, and your hand is contaminated with the virus, it will get the virus on that utensil or cup or soft drink bottle. And then that person who receives it will also have the virus on their hand. That's a fact. This virus does not infect the body through the skin, however. It would then need to be touched into the eyes, nose, mouth of the person whose hand is then contaminated. So because that's a harder sequence of events to happen, that is a less important way that this virus spreads. But it is definitely possible to acquire a virus like this and other respiratory viruses through contaminated hands, surfaces, and objects. But the infection does not enter the body through the skin. The infection enters the body through what we call the mucous membranes, the eyes, nose, mouth.
Okay, I alluded to before, about knowing whether or not what the impact was of folks gathering through protests, and I'm kind of getting to that point with this, next question, which is we're hearing that more young people now are testing positive. Can you explain why that is? Is it because we're doing more testing, and that's the difference? We've also heard recently about things like, in Alabama, youth getting together to try and expose them so that they can each get it. And I don't know whether that's part of the herd mentality or what the reason is. But again, just I guess fundamentally, what's the deal?
Yeah. So recently we've seen a dramatic increase in the number of cases, almost triple the 4 times what we saw in mid-June. And about fully a third of those are in the 20 to 29-year-old age range, and a half are below 40 years of age. So from 20 to 40 years of age. And, there are a number of reasons for this, most likely. First of all, I think many of our older adults who were really hit hard in the first part of the outbreak got the message about how to protect themselves. I think they're taking it more seriously with respect to staying home, avoiding contact, social distancing or physical distancing, a really more appropriate term, and wearing face masks. Younger people, I think, are less likely to be following that guidance. They're much more active. We know we've got a big outbreak at the University of Washington in the Greek system there. Those students were socializing. They were having close contact with one another. They were not wearing masks. And we know from our interviews with cases that many people just got way too active, way too quickly once we started to move forward from our stay-at-home order. So when we opened up some businesses and progressively allowed more people to get back to the things they really want to do and need to do, business, work, recreation, social, people got the wrong idea that the risk was gone and that the precautions were no longer necessary. And we know that people were spending more time together more frequently and without wearing masks frequently enough. And people were traveling and going to gatherings and parties. And now we're seeing the consequences of this. So I think what we need to do is understand that we, as a society, this virus will not go away, and we need to live with it for the long term. And we need to live somewhere between total lockdown and letting the virus run wild. And the only way we can do that is if we understand how this virus spreads and take the appropriate steps to stop it, which means we all still do need to limit our interactions and increase our distance from one another, decrease the time we spend with others, minimize the number of others we see, and use masks and have good hand hygiene. The virus is not forgiving. It will take any advantage to spread. It doesn't take a day off. It doesn't take the holiday off. It wants to meet your friends and family. It wants to come home from your 4th of July celebration and meet your neighborhood. And when it does that, it's going to make a lot of people sick, and it's going to continue to spread. We can't take off our precautions, just as the virus isn't going to take a day off. It's going to be with us for the long term.
I'm going to bring these points together. The reason why I brought up protests, again, that was people gathering. And whether folks are aware of it or not, or the impact of that, if you were Black, you knew you were dealing with a life crisis that preceded other things. And that is not the first time that decision has had to been made. And so I'm just distinguishing the difference between gathering and then maybe social gathering, and maybe nobody will see a difference. But at the end of the day, these are ways, regardless of the circumstance, that this spreads, is by close contact, by not wearing masks, by easily sharing things, by being spread to doorknobs, glasses, handshakes, all that stuff. We got about 30 seconds, Jeff, here, and I really appreciate you coming on and sharing this information. But I want to give you, I think you did a pretty good job of wrapping it up there. But if there's anything in this next 30 seconds that you want to share to folks, please do it.
Well, first of all, I want to say the protests were important. We need to address systemic racism and police violence, and I'm happy to see some progress being made. But if we're going to get together for protests like that, which are important, or for social events, which are important to us as individuals and families, we need to take precautions to stay safe, keep our community safe. Don't let your guard down. We're in it for the long haul. We can't let up. Keep yourself safe by wearing a mask, minimizing your interactions, and keep your community safe by doing the same. Thank you so much for having me on, Tony, and it's a pleasure to be with you guys.
Jeff Duchin, King County Health Officer, Medical Director. Thanks for joining us. We'll be back with our guest, Jorge Barron, Executive Director, and then we're going to talk about immigration. We're going to talk about public charge and how the coronavirus is impacting all this. We'll be back right after this.
You know you can't get enough of Rainier Avenue Radio. .world.
This is